All right, what's going on, Secoya Nation? Dr. Schilling with?
Hi, it's Dr. Jess.
And we're here to talk about, are you being robbed blind? What does that mean, being robbed blind?
Well, my perception from my end is looking at people just handing out money through insurance programs. And so I look at it from the DPC lens that we can save people money by direct primary care.
You probably learned about Hoover flags when you were in grade school, you know? Hoover flags, President Hoover, your flags are sticking out here. These are Hoover flags. I don't know if you can see my pocket down here, but you get the general idea. So we talk to families all the time who are interested in DPC, and they talk about, oh, I have a newborn who's 6 months old. My husband and I got insurance because we didn't want to be at risk for anything. So they pay $900 a month in their premiums before they ever get a deductible or have a copay or anything. That's one example. Then you have other families like yours.
Yep.
Classic. It's Health Partners.
Yep.
Classic, 3M, Health Partners. Sorry. It's a TikTok video for later, I guess. The point is, spending an exorbitant amount of money every month just to have a deductible of $15,000 after that, with your copays, with your incident fees. Like what we're talking about today. This new way that insurance companies are getting you, double billing, right?
Yep. So if you go in for a well visit and you have something show up, so you have a rash or your kid is sick and they have strep throat or something, you're billed for your preventative health visit, but then you're also billed for a second visit. And so you don't know what those costs will be until you receive your bill. Yeah,
it's exciting, Your visit turns from a $15 copay to $600. Your insurance company covers $200 of that, and you're left with another $400 out of pocket. Mm-hmm. Like, what family can sustain that unknowingly? Like, you go in there for, my kid's got a rash. Oh, I'll just take a look at it. At this point, you're going to be like, no, time out. Don't touch my kid. Yeah. You're going to charge me anything more. So these are just examples that you want to keep in mind if you have a traditional insurance plan, because honestly, they're fleecing you. You're literally losing money it's just running down your leg, as the metaphor goes, or you're pissing in the wind, whatever you want to talk about. There's plenty of metaphors on, we can get pretty exciting about this, stories. But the point is, going with DPC with Dr. Jessica is giving you the opportunity to have a direct relationship with your primary care provider, which gives you the opportunity to not have the insurance companies pick your pocket and then you get bills later. And not to mention, Dr. Jessica has a great graphic of this where insurance company has a stethoscope or an otoscope looking in the patient's ear, and then they have the doctor looking in the insurance provider's ear, and then they're like, hey, what do you think? And the doc says, well, not looking good, right? Something to that extent. But basically, the insurance companies are determining the level of care you're going to receive if you go through a traditional insurance company. Whereas you have Dr. Jessica, who does holistic healthcare, right?
Yep. So offering you basically whatever care looks like for you. And so whether it's coaching, wellness, providing supplement recommendations, things that help you live your best life.
Yeah, absolutely. So we want to invite you into an opportunity to see Dr. Jessica, see if DPC is right for you, get a meet and greet with her if you want, do a consult, whatever it takes to get you to know that this is the best option for you moving forward, and you would be absolutely out of your mind not to take advantage of it. So
seminars on the 6th and the 20th.
There you go. Anissa, great with the reminder. See, we forget all these things. We get all like Jojo the idiot circus boy over here, this new pet, I'm talking about this stuff. 16th and the 20th?
Yep.
Fantastic. Here you go. October 16th and 20th are coming up. That's next week?
This Thursday.
Okay, so that's the 6th.
Yep.
Okay, I said 16th.
6th and 20th.
Okay, this Thursday, October 6th, this is why I want to clarify, and the 20th. We're having DPC seminar to understand exactly what you're going to receive, how you can transform your life, save a bunch of cash, and get way better care than you could ever get anywhere else. Pretty amazing.
In person and Zoom.
In person and in Zoom. Let us know how you want to join us, all right?
Yes.
So we'll sign off for today. It was great to see you all. Have a wonderful day, and we'll talk